Rinses are essential organs that work 24 hours a day to filter toxins, regulate blood pressure, and keep the body healthy. But some daily habits can cause silent damage and compromise kidney function over time. Do you want to know what are the main habits that threaten the health of your kidneys and how to avoid them? Check out these 15 common behaviors that can harm these important organs. Number 1. Excessive use of painkillers. The frequent use of painkillers such as ibuprofen, paracetamol, and aspirin is a common practice to relieve pain in everyday life. However, these medications, when used in excess, can be extremely harmful to rinses. Analgesics, especially non-steroidal anti-inflammatory drugs, NSAIDs, prevent rinses from filtering substances that, in excess, become toxic to the body. These medications affect circulation in the kidneys, decreasing blood flow to these organs and over time impairing their function. For people with pre-existing kidney problems or who already have a chronic condition, uncontrolled use of painkillers can accelerate the progression of kidney damage. In some cases, prolonged use can lead to a condition called interstitial nephritis, which is an inflammation of the kidney tubules responsible for filtration. Therefore, it is essential to limit the use of painkillers and, if necessary, seek medical advice for alternative forms of pain management. Number 2, excessive salt consumption. Salt is an essential part of our diet and is necessary for fluid balance and muscle function. However, its excessive consumption has become one of the biggest problems in the modern diet, especially due to industrialized and ultra-processed foods. When we consume a lot of salt, the body retains more water to try to balance the excess sodium in the bloodstream, which increases blood volume and, consequently, blood pressure. This high blood pressure is one of the main risk factors for kidney disease, as it forces the rinses to work harder to filter the blood, leading to wear and tear on small blood vessels within the rinses. Furthermore, excess sound can accumulate in the body and cause edema, swelling in areas such as legs, ankles, and hands. To preserve kidney health, it is important to reduce salt in the diet, choose natural seasonings, and avoid processed foods, which generally contain high levels of sodium. Number 3, dehydration. Keeping the body hydrated is essential for kidney function, as water makes rinsing easier by helping to dilute the waste they must eliminate. When the body is dehydrated, blood flow decreases, which interferes with their ability to remove waste and toxins from the blood. Chronic dehydration can cause a condition called pre-renal azotemia, described by the accumulation of nitrogenous substances in the blood, such as urea. In more serious cases, prolonged lack of water can lead to acute kidney failure, a condition that requires immediate treatment. Additionally, dehydration can increase the risk of kidney stone formation, as there is less water to dilute the salts and minerals in the urine, which facilitates the formation of crystals. To maintain kidney health, it is essential to consume water regularly throughout the day, even when we do not feel thirsty, as this sensation may not be a good indicator of dehydration in some people. Number 4, lack of sleep. Sleep plays a crucial role in the health of all systems in the body, including the muscles. During the night, the body undergoes repair and restoration processes, including the renal system, which regulates fluid and electrolyte balance and helps with waste removal. When we sleep little or have poor quality sleep, we interrupt the natural rinse cycle and their ability to perform their functions. Sleep deprivation can also increase the production of stress hormones, such as cortisol, which has benefits for inflammation and increased blood pressure, both of which are linked to kidney health. Studies show that people who don't get enough sleep are at greater risk of developing chronic kidney disease due to the gradual accumulation of damage caused by a lack of adequate rest. To promote long-term kidney health, it is important to establish a consistent sleep routine, shifting at least 7 to 8 hours of sleep per night, and avoiding stimuli that may enhance rest. Number 5, Excessive sugar consumption. Excessive sugar consumption is another villain for kidney health, mainly because it increases the risk of conditions that directly affect kidney function, such as obesity, type 2 diabetes, and hypertension. When you eat a lot of sugar, your body produces more insulin to regulate blood glucose levels. However, constant exposure to high levels of glucose and insulin can lead to insulin resistance, a condition that precedes type 2 diabetes. People with diabetes have a high propensity to develop kidney disease, as excess glucose in the blood can harm the small blood vessels in the kidneys. Furthermore, sugar is not only present in desserts, but also in many processed foods, drinks and energy drinks, which increases consumption without us often realizing it. Reducing sugar and opting for whole, natural foods can be an effective way to protect your rinses. Number 6, excessive alcohol. Drinking alcohol occasionally is not usually a problem for most people, but excessive alcohol consumption can have serious consequences for kidney health. Alcohol is a substance that dehydrates the body and causes an increase in blood pressure, two conditions that put a strain on rinsing. Drinking more than 4 drinks a day significantly increases your risk of chronic kidney disease, as well as other liver and cardiovascular problems. In people who consume alcohol and also smoke, the risk of kidney problems is even greater, as both substances affect blood circulation and increase oxidative stress. To protect your health from rinsing, it is important to moderate your alcohol consumption, staying within the limits recommended by experts. Number 7, processed foods. Frequent consumption of processed foods, such as canned, frozen, and fast food, poses a major threat to the health of rinses. These products are, in general, rich in sodium and phosphorus, which, in excess, are specific for those who already have kidney problems or want to prevent diseases in the renal system. When sodium is consumed in large quantities, it forces the rinses to work harder to filter and excrete the excess, which can result in high blood pressure and fluid retention in the body. Phosphorus, in turn, also puts a strain on the kidneys, especially in people with kidney dysfunction, as it accumulates in the blood and affects the quality of bones and the cardiovascular system. Additionally, ultra-processed foods contain preservatives, organic sugars, and trans fats, which increase the risk of inflammation and promote the development of diabetes and heart disease, all of which are associated with a higher risk of chronic kidney disease. To preserve the health of rinses, it is essential to prioritize natural and fresh foods, minimizing the consumption of processed products. Number 8, excess meat. High consumption of meat, especially red meat, is a common habit in many modern diets, but it can have a detrimental effect on rinsing. Meat is rich in animal proteins, which, when metabolized, produce a high level of acid in the blood. This acid needs to be filtered through rinses to maintain body pH balance. However, in excess, the accumulation of acids can lead to a condition called acidosis, which overloads the rinses and impairs their function. Furthermore, excessive meat consumption is also associated with a greater risk of kidney stone formation, as protein metabolism increases the excretion of calcium and uric acid, substances that contribute to the development of kidney stones. While protein is essential for muscle growth and maintenance, it's important to balance a diet with a variety of fruits, vegetables, and plant-based protein sources, which are less harmful to the kidneys. Number 9, sitting for a long time. Physical inactivity and the habit of spending long periods of time sitting, whether at work, at home, or during leisure activities, can also have negative impacts on kidney health. Lack of movement can contribute to increased blood pressure and the accumulation of body fat, both factors that increase the risk of kidney disease. Studies show that people with sedentary lifestyles tend to have less efficient blood circulation, which affects kidney function by reducing blood flow to the kidneys. Furthermore, inactivity is associated with insulin resistance and high blood sugar levels, factors that contribute to the development of diabetes, one of the main causes of kidney failure. To maintain healthy rinses, it's important to incorporate movement into your daily routine, even if it's just short breaks to walk or stretch, which improves your metabolism and overall body health. Number 10. Smoking. Smoking is linked to a number of health problems, including kidney disease. Cigarettes contain toxic chemicals such as nicotine, tar, and carbon monoxide, which affect the circulatory system and compromise kidney function. Smoking reduces blood flow to the rinses, overloading these organs and providing their efficiency in filtering waste from the blood. Additionally, smoking increases oxidative stress in the body, leading to cellular aging and hardening of the arteries, which is harmful to kidney function. Smoking is also a significant risk factor for renal cell carcinoma, a type of cancer that affects the kidneys. For those who want to preserve kidney health, giving up smoking is one of the most important decisions, as the benefits of stopping smoking are reflected in improvements in the renal system and many other aspects of health. Number 11. Illegal drugs. The use of illegal drugs such as cocaine, heroin, and ecstasy has devastating effects on the body, and rinses are especially affected. Cocaine, for example, causes vasoconstriction, the narrowing of blood vessels, or which results in increased blood pressure, one of the main causes of kidney damage. Heroin, on the other hand, when mixed with toxic substances such as talc or starch, can lead to acute kidney failure. Furthermore, prolonged use of illegal drugs increases the risk of serious infections and kidney disease caused by the substance's toxicity. The use of ecstasy, or MDMA, is especially dangerous for rinses, as it causes severe dehydration and can lead to a condition called rhabdomyolysis, where muscle tissue breaks down and releases toxins that overload rinses. Avoiding illicit drugs is essential to maintaining kidney health and preventing the development of serious complications. Number 12. Excessive physical exercise. Exercising is essential for the body's general health, but excess physical activity can also pose risks, especially when rinsing. Intense physical exercise, when performed beyond the body's limits, can cause a condition called rhabdomyolysis, in which muscle tissue breaks down and releases a protein called myoglobin into the bloodstream. This protein is filtered through rinses, but in large quantities it can cause significant kidney damage and even kidney failure. Rhabdomyolysis also causes symptoms such as severe muscle pain, cramps, and dark urine. Therefore, it is important to respect your own body's limits and avoid strenuous physical activities that could put your rinses at risk. Maintaining a balanced exercise routine with professional guidance is the best path to full health. Number 13. Soft drink consumption. Soft drinks and energy drinks are among the most consumed drinks in the world, but their impact on kidney health is quite worrying. These drinks are rich in sugars, artificial sweeteners, and phosphoric acid, ingredients that overload rinses. High sugar consumption increases the risk of diabetes and kidney stones, two conditions that directly affect kidney function. Even diet sodas, which contain artificial sweeteners, have been linked to kidney problems because some sweeteners alter the body's metabolism and electrolyte balance. The phosphoric acid present in soft drinks also contributes to blood acidity and can cause acidosis, a condition that, in severe cases, leads to kidney failure. To protect your rinses, a healthy alternative is to opt for sparkling water or natural infusions without added sugar. Number 14. Excessive caffeine consumption. Caffeine, present in coffee, tea, soft drinks, and energy drinks, is a popular stimulant, but excessive consumption can be harmful to rinses. Caffeine has diuretic properties, which increases urinary frequency and can lead to dehydration, a factor that affects the rinse's ability to filter specific blood. Furthermore, excessive caffeine consumption is also associated with increased blood pressure and stress levels, which, in the long term, can compromise kidney health. People who consume multiple doses of caffeine per day can overload their rinses and increase their risk of developing chronic kidney disease. To protect your rinses, it is recommended to reduce your caffeine intake and prefer alternatives such as herbal teas and water. Number 15. Holding urine for a long time. Holding urine for prolonged periods is a seemingly harmless habit, but it can cause considerable damage to the health of your urinary tract and urinary tract. When the bladder holds urine for too long, internal pressure increases, and this can weaken the bladder muscle over time, resulting in problems such as incontinence. Furthermore, keeping urine in the bladder for prolonged periods increases the risk of urinary infections, as bacteria have more time to proliferate in the urinary system. These infections eventually migrate to the kidneys, causing a condition called pyelonephritis, which can cause permanent damage if left untreated. Listening to the body's needs and emptying the bladder regularly is an essential practice to protect kidney health and prevent complications in the urinary system. Taking care of your mouthwash requires paying attention to your daily habits. Avoiding excess salt, sugar, caffeine, alcohol, and meat, as well as reducing the consumption of processed foods and giving up tobacco and illicit drugs, are fundamental attitudes. Staying hydrated, physically active, and respecting your body's signals are also essential. Small changes to your routine can preserve kidney function and ensure better health.